year is 1924. Deep in the eastern province of Kenyan colony, a modest building stands in Embu district. They call it a dispensary, a small but hopeful light in a growing community, longing for accessible healthcare.
I wish to now take this opportunity to inform the people of Embu County that we have a reason to now celebrate where God has brought us in terms of our Level 5 hospital. Believe it or not, it's now 100 years since the Embu Level 5 hospital came to be. Of course, it's been ups and downs, but we are at the point where we need to celebrate this far God has brought us. And especially so, celebrate the gains we have achieved in the last 3 years.
But the journey has not been a bed of roses. Being around for 100 calendars is more than remarkable. It is a story of resilience. What began as a small dispensary in 1924 was in 1935 upgraded to a health center. By 1941, the first medical officer was posted to the now 30-bed ward capacity sub-district hospital. The 1960s brought a major upgrade, the status of a district hospital. By 1984, Embu was made a provincial referral hospital, serving not just Embu, but patients from Marsabit, Meru, Ukambani, and even the southernmost parts of Tana. But before I delve further with history lessons, let's see where we are 100 years later.
Other medical suppliers, none wanted to supply to Embu County because of pending bills. So we went out of our way, ensured we financed the health sector by providing adequate resources through the budget, and were able to pay most of the pending bills, if not all. As a result, KEMSA was now comfortable to continue to give us the much needed medical supplies by way of pharmaceutical, that is drugs, and non-pharmaceuticals. The other thing we looked at is our dilapidated health infrastructure. So if you went to like Level 5 hospital, our maternity was in bad condition. We were only dealing with an average of about 20 mothers per week, because most of them had run away from our hospital, big as it is, because the infrastructure, the wards were very bad. The beds were very bad. There was no linen. They didn't have gowns to wear. The labor ward, the delivery room were in dire state.
Indeed, before her tenure, the hospital was serving just 6,000 people a month. But where are we now?
Embu Level 5 serves a population of about 33,000 patients approximately. But in outpatient, currently we almost see 11,000 patients, 11 to 12,000 patients. It has really changed since we even have an ICU, HBU, and now we'll be having an emergency center. So we have a little setbacks here and there, but there's an improvement with as the data will show, with the admissions, the workloads from when we devolved. Okay?
So what could be driving this remarkable increase? To understand better, let's take a walk through the different departments within the hospital. One of the most frequently asked questions about Embu Level 5 is, do we have enough drugs? As such, to kick us off, we explore the pharmacy unit.
We serve about 800 to around 1,200 patients per day ordinarily. But since May this year, the numbers have gone up massively. Partly, of course, because of we have a higher range of services. So one of the drivers for those numbers has been oncology. We've tried to procure and make sure oncology commodities are available, and the county has made arrangements where we have a visiting oncologist who serves our clients. So over time, wamekuwa wakiona daktari yuko na daktari akiwa, the patients will come. Now on our part, once the patients come, we source the commodities, we make sure the commodities are there. So that is one of the drivers for the increased patient numbers that we are seeing, especially for the better part of this year. The pharmacy department essentially has three sub-departments. We have three pharmacies. We have the main pharmacy that is located just opposite radiology department, that caters for both outpatients and inpatients. Inpatients are those who have been admitted to the wards, where their drugs are fetched by the nursing officers and the porters. Then we have an oncology pharmacy that caters for patients in the oncology clinic, again both in and outpatients, oncology cancer. Then we have another pharmacy adjacent to the MCH unit that caters for our HIV/AIDS clients. The entire unit, composed of consultation, nutrition, lab and pharmacy, is called the CCC, the Comprehensive Care Clinic. So those are the three areas where we serve our clients. This is one of the commodities that is used in our oncology unit for management of clients with breast cancer. We get this from KEMSA. It's available to us from KEMSA at an access price of about 37,000 shillings. That is the price to the client. The commercial price for this is well over 80,000 shillings. So yeah, our clients have really benefited from that access program.
Well, before we transition to another department, there is a person responsible for the healthcare of more than 600,000 people in Embu County, the Health CEC.
So personally, I have a lot of nostalgic feelings when I get to Embu Level 5. It was our go-to hospital from when I was very, very young, 5 years old. That is my first experience with the hospital. My first injection that I can remember was in the Embu Level 5 hospital. When I was in standard 3, I broke my hand and it was treated there. So it has been our go-to hospital. My primary school was just behind Embu Level 5 hospital, St. Michael Primary School. And every time even somebody used to get hurt as we were playing football or in the sports, that was a go-to facility. So when I look at the Embu Level 5 today, I have a lot of nostalgic feelings. My firstborn also was born there. I have a very personal attachment when it comes to Embu Level 5, and I would want it to grow. We have had quite some journey with the Embu Level 5 hospital from where we found it at in August 2022. When Her Excellency the Governor, Cecily Mbarire, took over the reins of government in Embu County, her first order of business was to appoint a task force that had been mandated primarily to look at the ailments in the health sector and the revenue section. I was privileged to be one of the members in the task force, and as we drafted the report, we were very much aware of all the problems that were ailing our health sector in Embu, and particularly Embu Level 5 hospital, which covers almost over 70% of the patients served in this county per day. In the task force, we were able to dissect all the areas, and the health sector in Embu was in a very, very precarious state then. That time, that facility was serving less than 200 people per day. So because Her Excellency rode on the platform of improved healthcare for the people of Embu County, Embu Level 5 was one of the key priorities in this government. And in the first year, a lot was achieved. Because of the Madaraka celebrations, we were also able to get support from the national government to improve some of the wards, especially the newborn unit. So in this new administration, one of the greatest milestones that has helped the health sector and Embu Level 5 particularly is enactment of the Embu County Health Services Act. In this act, we were able to ring-fence all the revenue collected in the facilities to remain in the facilities for the improvement of the services that were offered there. So this has helped us really boost services in the hospital from that humble start of about 200 people per day to currently serving about 1,100 every day. We have also been able to revamp many departments there that were previously non-functional and are able now to serve our counties every day and every month across the year.
Patients from outside there, they come into the clinic. The first thing that we do is do a visual acuity for them. Visual acuity is basically to see how well they are seeing. Because you know, when you come to the eye clinic, the main problem, if it's not pain or anything else, is unaona. So when they come, we take a visual acuity from here, and then they are attended in any of these clinics. We have the examination room, about 3. So at this point, that is where the patient are examined and a prescription is done. And we normally use the system. Again, you can see that's why we have computers. We normally key in the data and then send to the pharmacy if you're going to the pharmacy, and also to the record so that we can have data on these patients. We've received some donations again from our partners. We have some for Embu Level 5. The others are going to Ishiara, Siakago, Keretire, Gategi, and Kenjokoma. So again, in those places we've established satellite clinics, eye clinics. So that's why you're going to distribute these classes for people to access them at those facilities. Those clinics admit the patients in there. So we go and support them. From Level 5, we go and support them at their locality. So that surgeries are not no longer, patients don't have to come from Runyenjes to come to Level 5 for surgeries. They are done in Runyenjes. And if we have others who are admitted in Ishiara, we also go to Ishiara. Then also, I'll talk that the partner has also given us a portable microscope that we can carry and do outreaches where we don't have a microscope. Like in Siakago, we are able to move there with the portable microscope and do surgeries. Like Gategi also, we are able to move to Gategi and do surgeries in Gategi.
What truly defines a hospital is not just its buildings or machines, it's the heartbeat, the nurses. They interact with the patients at a personal level on a day-to-day basis with utmost compassion and care. The head of nurses has been around since devolution, and he knows the facility like the back of his hands.
This department has 215 nurses. These nurses are distributed in the various wards and departments. We have about 16 wards in this hospital. These range from medical wards. We have 2 male medical wards and 1 female medical ward. We have surgical wards. We have 1 male medical surgical ward. Then we have one female surgical ward. We have one male orthopedic ward. We also have a eye ward, where we admit ENT and eye cases. We have maternity wing, which has 7 departments, stroke wards, starting from labor ward to antenatal ward, 2 postnatal wards, one for the normal deliveries, the other one for the post-CS. We also have a newborn unit, which is ward 16. We also have a gynae ward, that is ward 17. We also have other wards, including ICU and HDU. We also have 8 clinics.
We are in a digital era where investing in technology is synonymous to creating solutions to most human problems. Embu, technology is its second name. A stroll around the radiology wing tells you more than words can. In 2025 alone, at least 5 heavy-duty machines worth millions of shillings have been procured, a statement of intent that this county is investing in precision medicine.
This is an OPG machine. It's used for imaging of the dental formulas and also for fractures of the mandibles and the rest, and also the sinuses. General duty, that's general x-rays for let's say patients, for fractures, patients that want to know things like TB and other medical causes, and also let's say patients for abdomen who have abdominal issues like intestinal obstruction. They use this machine. So this is a CT scan. It's used for imaging mostly of let's say patients who are involved in the accidents to rule out for any internal injury, and also for staging of cancer patients. New ultrasound unit. It was installed around three months ago. It's used for basically imaging of the soft tissues of the body, like now your kidneys, liver, abdomen, some growth in the soft tissues, and also imaging of the expectant mothers, going to look at any abnormalities in the fetus. That's the work of this machine. Yeah.
Kidney disease is a silent epidemic. The Kenya Renal Association estimates that 4 million Kenyans live with it today, and by 2030, that number could rise to nearly 5 million. For many, survival depends on access to dialysis. At Embu Level 5, 10 dialysis machines stand as lifelines. To put this in context, Kenyatta University Teaching and Referral procured 20 machines in 2023 for a facility that serves the entire country. For a regional facility like Level 5, having 10 machines is such a milestone.
We take care of the patient with kidney issues, kidney disease. We have qualified doctors, nurses who are well trained, even our engineers who take care of machines. Basically, we have many patients. We do book them. Each day we are able to do around 10 patients. Then they will come another appointed time. So we have around 10 machines which we use in our units. From there now, if we have a very sick patient, we have doctors who come, they review the patient, and then they are either admitted in the wards where they are also taken care of. These are our machines. This is one of our machines that we normally use. It mimics the functions of the normal kidney. The work that the normal kidney does, if the kidney fails, the machine will do it. So basically that's what we normally do.
Behind these immense improvements is one woman, Ms. Bansi Mutua, the CEO of Embu Level 5. Under her leadership, departments once forgotten now stand modernized, ready for the future.
Our patients in the hospital, the first thing is the clinical services. Every patient visiting this hospital, we are very keen on management of that patient in the ward. They get drugs. Those who need lab services, we offer. Those who need X-ray services, we do. And then in the hospital, we have catering services. Sometimes back, like 4 years back, our patients would lack food. Currently, our patients are getting enough food. Level 5 hospital has also improved in terms of revenue collection. Actually, within the county, it was the best institution to have collected the highest revenue for this county. We took up the matter of SHA. We were able to train our people. We were able to sensitize our citizens. And we are very keen at the point of admission to ensure that our patients get admitted through SHA. Out of that, we've been able to do claims and being paid. And the period ending 30th June 2025, we managed to have collected 474 million in revenue. This is the revenue now that we use to improve on the services, to buy the drugs, to repair our machines, our equipment, to also maintain our staff and patient welfare. Our hospital also offers something called medical electives. This is a kind of training where students from other parts of the world, Britain, Asia, Japan, Chinese, just to mention, but a few from a body called Moving Mountain. They come to the hospital and they rotate within 6 weeks in different departments, gaining knowledge before they graduate. The hospital also offers internship opportunity to students who have graduated, right from the degree, the certificate, diploma. They go through internship program for 1 year. This is a period where they are mentored by the other surgeons, by the other doctors who have gone through the process. And when they complete this 1 year, these are now given licenses to be practicing doctor, staffs, and the rest. In an effort to ensure our patients are comfortable in this hospital, we have completed state-of-the-art ward called Bandea, which has 66 bed capacity. It is complete now. We are waiting for equipping, and we have money set aside in this year's budget, that is 2025-2026 budget. Once we equip that ward, then we will have enough space for our patients, those from within the county and also outside.
We are also putting up currently a state-of-the-art emergency and trauma center where emergencies will now be handled separately from the outpatient services, reducing greatly the turnaround time between when somebody is brought to the hospital and really attended to, because we are very keen.
On the works that are being done here, every external works, that is the gabroring, the new gates, the external painting, the roof, all those are being done by the county government of Embu through Embu Level 5. The internal works that we have seen inside there are being done by our partner, Emergency Medicine Kenya Foundation. So the county government is doing that at a tune of about 4 million plus, and then our partner will be doing the internal works, including equipping, at a tune of about 7.9 million Kenya shillings.
The Regional Blood Center annexed to Embu Level 5 is a story of its own. It is state-owned national facility, but it plays a critical symbiotic role with Embu Level 5.
Embu Regional Blood Transfusion Center is underneath the Ministry of Health, under the Directorate of Kenya Blood Transfusion and Transplant Service. Our center, or rather our blood bank, we normally serve 9 counties, and these counties are Embu, Tharaka Nithi, Meru, Isiolo, Marsabit, Laikipia, Nyeri, Murang'a, and Kirinyaga. More so, in those counties, apart from Embu County, we normally have a blood satellite, or rather county blood satellites. So for them, they collect the blood, but we have a centralized blood screening. We normally do the blood screening from our side, and also our national testing laboratories in Nairobi. So they collect blood, but we screen for them. But for us in Embu, is that Embu, they don't have a satellite, but we come in for them. So this kind of a symbiotic relationship that we have been having is that for Embu Level 5 and a Regional Blood Transfusion Center, you cannot separate them, because about 80% of our blood collections is consumed by Embu Level 5 and also other Level 4 hospitals. So it has been a journey, simply because it was the center, or the regional center, was started way back in 2002. That's the time that the construction was done, and also it was inaugurated by American ambassador. Normally what happens is that for us, we normally go out to collect blood, or rather for blood campaigns or blood donation exercises. And then when we get this blood, we normally take it, or rather we screen it for 4 markers, or for 4 diseases. We normally screen it for HIV 1 and 2, hepatitis B, hepatitis C, and syphilis. And also we do the blood grouping. After we group, and after the screening, that's the time that we normally sort the blood, and whichever is safe, it is earmarked for distribution to our transfusing facilities. And most of our transfusing facilities, they are in 3 categories. We have the GOK, which normally takes the lion's share, and the faith-based organizations, or rather faith-based hospitals, and also the private. So this issue of blood transfusion, or rather blood service, is a multidisciplinary, or rather more sectoral. We have our own stakeholders, because all the transfusing facilities, we normally have a kind of a rapport, or rather some engagement with them, starting, and a case in point is Embu Level 5.
A fun fact, there's a machine that can extract blood platelets without drawing whole blood from a donor.
Normally what happens is that sometimes a donor might come, and the component which is required, or the product which is required within the whole blood, is a platelet. So what is going to happen is that the machine is able to extract only the platelets, and then it returns the whole blood, or rather the other components of blood that are not required by the patient, to the donor. So for apheretic platelet donor, you can donate after every 2 weeks. Whereas vis-a-vis, when you donate whole blood, you can only donate after 3 months if you are a man, or after 4 months if you are a lady. So you find that at least for those who need those platelets, or the platelet donors, they can just come frequently.
Back to where life begins, children. Embu Level 5's Maternal and Child Health Department boasts unmatched skills, attention to patients, and even free giveaways for mothers and newborns.
In fact, the records that we have is that we are able now to deal with up to about 500 plus mothers coming into Embu Level 5 hospital in a month and getting their babies and leaving. As a result, that also put pressure on our theatre, the maternity theatre, because the number of mothers who now needed a cesarean section increased, and so we needed to ensure we have at least 2 working theatres for the maternity wing, and I'm happy that we've been able to now work at equipping the second maternity theatre, so that in case we have 2 mothers who need that service at the same time, we are able to take care of them.
So MCH department, it's an integrated clinic where we offer a variety of services. We have antenatal care services where we are seeing pregnant mothers at all levels. And when the clients come for antenatal services, we offer them health messages, their lab tests that they do, we take history, and also we do examination for the client. And according to the guideline also, the mothers usually go home with the mosquito nets for prevention of malaria. We give them supplementation of IFAS, tetanus toxoid vaccine, we deworm them, and HIV testing is also done. And this one is to prevent mother-to-child transmission of HIV.
Here at Embu Level 5, it was striking to discover that the hospital runs the largest oxygen plant in the region, producing up to 800 liters every minute. A steady breath of hope, powering the survival of the most fragile lives.
Our machine is still one of the biggest machines in our region, because it has a capacity of 800 liters per minute production. So it's one of the big machines in our region. We still have one of our biggest machines for refilling. So we still refill our oxygen from our plant to supply to the sub-countries.
But the story of quality healthcare in Embu cannot be told without writing the name of Governor Cecily Mutito Mbarire. From allocating the highest ever budget to the pharmacy unit, to overseeing the construction of a modern private wing, to expanding the workforce, her administration has redefined what transformation means in public healthcare.
Well, I really want to take this opportunity to thank all those that have partnered with us in getting our health sector to where it is today. As I said at the beginning, we started from point 0. In fact, people didn't think we could hack it. And along the way, we also got very many challenges, but we never gave up. We also got people who criticized us without understanding where we were coming from, but we still didn't give up. So I want to, in a very, very big way, thank the national government, because they've been a major partner for us, especially in areas around digitalization, around improvement of some of our infrastructure, giving us the right technical skills that have been able to get us to where we are. I want to also truly thank KEMSA and MEDS. That is where we get almost 100% of our drugs and non-pharmaceuticals. Thank you very much. There are times we've come to you with no money, but because you now trust us, you're able to give us those supplies and we pay later. We really want to appreciate that, and we promise to continue being good partners for you and for your business. I want to thank all the health providers that have worked with us one way or another, our staff, wherever they may be, those ones who are running facilities right into the village level, away from the headquarters, and I've had to go and work with the communities there. We appreciate the work you're doing for us. We appreciate the work you're doing for the county. We appreciate the work you're doing for the people of Embu County. May you continue to work hard. May you continue to follow on what's going on. Continue to make use of the skills you've learned, especially the digital skills, so that we are able to know what's happening in every facility across the county. We want to thank all the development partners that have stood by us. We've had quite a number that have partnered with us in different areas in the health sector. There are very, very many. Thank you very much for standing with us. And also, thank you to the Council of Governors that has really, really been instrumental in helping us turn around our health sector. Asanteni sana. May God bless you.